Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Chandrakala V. She did her BDS from Kaligra Sangha Dental College and then MDS from Bapuji Dental College, Davangere. Presently, she is working as a professor of prosthodontics in KLE Dental College, Bengaluru. She is the winner of Best Scientific Paper, Best Innovative Poster, won the prestigious Walkaway of Discovery Award at the Asia's largest biotech summit in 2024. And she is also the convener of Women's Dental Council. She has been a leader and uniting the women dentists, and that is a great thing. Now, in the last episode, she described why the oral hygiene is important, why we do where we lose the tooth, and how we have to protect our teeth. But today she has come to tell us how artificial denture can be used, whether they are fixed or removable, when to do and how to do and why to do. All that she's going to explain. Welcome, Chandrakala.
Namaste, ma'am. Greetings for the day. So we welcome you also as well as the viewers. As you told, ma'am, in the last episode, we discussed about the reason for tooth loss, then what are the importance of the teeth, and also how to maintain about it. So today we'll get to know about what happens if we don't get replaced our teeth actually. So as we know already, definitely it is going to affect the beauty of some person. Okay, so definitely when some person is seen without a teeth, they themselves they may not like it to see themselves in the mirror.
Yes.
So
Yes.
that
Yes.
they definitely the beauty is definitely affected. That is the first thing actually. Then obviously their mental
And they can't
health
smile, they have to hide their mouth like this
yeah,
and
yeah.
smile like that.
Every time
Okay.
they may not be confidently smile, and
Yes.
we do something we call Duchini smile, ma'am. So what exactly it is means best person I can give example is Barack Obama.
Mm.
Okay, so he is he had good the Chinese smile that is from molar to molar. So when they smile
Okay.
from the
You can see that from here
as
to
you
there.
have also had, yeah, you also had the Chinese smile. So you're
Okay.
you will get to wrinkles at your eyes. So that is what the
Okay.
Chinese smile. May not be they can smile that confidently.
Mm.
So
Mm.
obviously that hindrance will be there. So then,
Mm.
what are the other things, ma'am? Means if suppose if one tooth
And
is
suppose they have lost one or two,
yeah,
they don't want that to be seen, then they'll give the
yeah,
Mona Lisa smile.
yeah, exactly. And what happens actually, suppose if this one tooth is missing now, right now, it has fallen on its own, or because of some traffic accidents or something, it has fallen means we have to get it immediately replaced. Otherwise, what
Mm.
happens, the adjacent teeth and all may move, drift, means it can
Yeah.
move either
Yeah.
nasally, distally, or
Okay.
up way, like anything. So that
Mm.
will eventually what it will lead to, the gum
Mm.
around that surrounding bone, it will become
Mm.
loose, and eventually
Mm.
one by one every teeth will fall on its own. So that should not be
Oh.
supported. It should be avoided. So for that we have to get
Like
it
a string
immediately
of
replaced.
pearls, if one pearl falls,
Yeah.
all others
Yes,
will
yes,
follow.
everything
Like
will be.
that.
So the God has
Okay.
created so such a beautiful way that
Mm.
smile, or not only smile, even the arrangement of the teeth also he would have done
In
so
line.
neat.
Yeah.
Yeah.
Correct.
This is the one. Then facial height, as I told, beauty is affected by the decreasing facial height. Then
Mm.
the
Mm.
wrinkles around the eyes, mouth, all
Mm.
that will be there. And also the pronunciation. It will never be clear as
Yeah.
when we have the teeth. Definitely the pronunciation will be bad only. So
Yeah,
for to
yeah.
improve
We have seen,
pronunciation,
the olden days,
yeah.
when the
When
dentures
the
are
cracks,
taken, the face
logos
used to
are
be like this, like
yeah.
Bochubai,
Yeah,
we used to say. And then when you put, the face looks better. So
better.
that is the thing, yeah. And also pronunciation. It
Yeah.
is so difficult without teeth also. Okay, yeah.
Awesome. And also, not only it is just replaces the teeth, ma'am, even the surrounding teeth, also the below the adjacent bone, whatever is
The
there,
gums
it
and the
preserves
teeth,
that
and yeah,
also. Yeah.
yeah.
It preserves that
Okay,
bone also for the longer time. So that's why we have to replace it
okay.
immediately as early as possible.
Okay, now you said that it has to be replaced, and it Another one has to be put, the artificial tooth has to be put. Now, how do you put? Do you fix it or it is removable? Which one is better?
Actually, there are two kinds of replacements, ma'am, or we can say processes also. As you can see in this picture, like we can just replace one or two teeth which are removable, which can be removed by the patient and that can be placed back in the mouth by themselves, by the patient only.
Okay.
So these are called as removable processes, as you can all see. So it is made up of usually something called a material called acrylic. It is nothing but a plastic kind of material.
Okay, and
Can
it is an
be
inert material. It doesn't damage the
may
existing
be
gum.
biocompatible, ma'am, which is can be. It is safer to use it in the mouth. So after testing so many things only, they would have given in the market. So then we have something called as the fixed one. So as you can see in this picture, so like you can see, so one tooth is missing. So by grinding little bit the adjacent teeth, so I am going to fix the teeth.
So they have the clip, is it?
Yeah.
The clip,
Yeah.
the
So
catching
this
the tooth. Yeah.
with the help of some cement, so I'm going to fix this. So it acts as a bridge. So three unit, three teeth, like it acts as a bridge. So this is one type of fixed one.
This bridge is fixed or it is removable?
It is fixed. It is fixed. It can't be removed by the patient. If they have some problem, they have to visit dentist only and get it changed or replaced.
Okay.
So this is one type. Then you can see, suppose
And
some
you
patients
have a removable bridge also, no? Removable bridge and non-removable bridge. Both are there. Okay.
Removable bridge in the sense we have something like this, ma'am. Like it can be just removed and place it back by the patient itself. Then we have something called as implant. So as you can see in the bone, jaw bone only, we will be placing some screw. So that is made up of titanium. Nowadays, so many other materials are coming in the market. So with the help of this titanium screw, after placing this with the help of some small surgery, after leaving it for like some nearly 1.5 to 2 months, 3 months, depending on the clinical conditions, then we are going to replace this tooth on that. So this is called as implant processes or implant tooth. So, but this implant can't be done for each and every patient.
Yes.
So it depends on their clinical conditions too. The bone height.
If they have a diabetes and the bone resorption is there, the bone is not there, and infection is there in the surrounding. Yeah.
Available space from the opposing tooth also, it matters a lot. And also their systemic health, the diabetes, the blood pressure, the heart diseases, all that matters a lot to decide whether we can deliver such treatment or not for that particular patient. So it is always advised not to Google. Google is just for the basic information. So not to follow that idiot syndrome. So which will obstruct the treatment options for the doctors. Actually, it becomes very difficult actually. So some patients, they do agree, like they do after the convincing, like this is the best treatment, they will agree. But some patients, they will have fixed already early only that they want this particular treatment only, which is not possible.
Okay. And the options are there. And is the choice given to the patient or you decide? Because depending on the condition, you decide, like a tailor-made treatment for the person, or the choice is there. How is it?
Actually, like ma'am, one thing first is the clinical scenario. Based on that only, first we will decide whether the removable processes can be given or the fixed processes. There comes the first role of the dentist to decide which treatment is best for them. Then comes the affordability. Actually, whenever it is fixed treatment, obviously it is like cost effective. Many patients can't afford. So for such patients, if they don't want to spend too much of money, then definitely they can go for the removable options, which are little lesser in cost.
Less costly.
So, yes, ma'am. And as you are, I think, aware, ma'am, so the government of Karnataka, for the people like beneficiaries who are under below poverty line, so they have made a free treatment for the replacement of one or two teeth or complete dentures like this. Full set also they can done. So for this, they can visit the nearest college or government hospitals and they can get it done.
Oh, that is so very nice. So that means, the people who have lost their teeth, and they should not feel bad that, oh, I cannot grind or enjoy the kodbale, chakli or nippattu. They can come and have the teeth and then enjoy their life even at the old age. Yeah.
Yes, ma'am.
And the younger people can Google as a guide, but come to the dentist and listen to them and get the treatment.
exactly.
Okay.
As
Yeah.
you told, ma'am, like even with the removable processes also, if their neuromuscular control is good, they can chew,
Yes.
as you told, chakli, kodbade
Yes.
and all also they can
Yes.
enjoy. But somewhere like that will be better with the fixed processes. That is also better.
Okay. Okay. That's so nice. So
Yes.
finally, what would you like to advise, like, the key points and advice to our viewers? And then
So
if they have any problems, let them ask you so that you can guide them
yes,
individually. Yeah.
yes, ma'am, definitely. First and foremost, I request the viewers that so how other health of the body is important. Health of the mouth is also very, very important. It is
Mm.
not just because of the teeth. Please don't neglect. So as soon as like if you not only the tooth fall, it is any other treatment or any other problems they get in the mouth, immediately they have to visit the nearest dentist and then they have to get it checked and get treated. So also they can come to our colleges. Our college, KLE college is there, and nearby dentists, many are there. Government hospitals are there. So many are there. They can visit. If they have any query, so they can visit me also, or they can write a mail to me, drchandra10@gmail.com. That is my mail ID. They can contact me. So by God grace, it's been like 20th year of my practice. So
Mm.
till now, whichever big hospital I go or smaller clinic I go, I never charge for the consultation. So it is completely
Okay.
free. Only if I
Okay.
do treatment, I take the charges. So that advantage they can always avail. So please, they can contact me, ma'am.
Thank you. Thank
And
you. Thank you so much.
thanks a lot to you, ma'am, for making me to give this small interview. So
No,
hope
no.
this is
The
beneficial for the
timely advice is very important because many
yes,
people, they keep on losing their teeth
yes,
and they say that it is old age, and the negativity is there, and that should
yes.
go. So
Yeah,
even at the old age they can have a wonderful denture and lead
yes,
a very give a beautiful smile as well as eat
yes,
well.
that is absolutely true
Yeah.
too, ma'am. For this,
Yeah.
with just I want to share one just incident which happened truly when I was like in doing PG. So one lady like who was married during the wedding, like they had he like hided the thing that she don't have teeth. So somehow marriage went on. Later they got to know that she don't have teeth. So that person like left her, like abandoned her, anything.
Oh
So
my
that
God.
father used to come and ask us,
So
request
sad.
so much, ma'am, like do something. But we
Mm.
couldn't help us anything because no bone was left. So that is
Mm.
the request I can make it to the viewers. As soon as the tooth falls, please preserve your bone by getting it
Mm.
replaced immediately. If bone is not
Okay.
there, if bone get resolved, not only any dentist,
Nothing
even
can
that
be done.
guard
Yeah.
also like it can't help. So that is
Yeah.
the
Yeah.
like request I can do. So thank you so much, ma'am, for
Yeah.
this
Thank you so much.
your
Thank you so
humble
much.
nature for this
Thank you.
interview. So and also
Thank you.
making me part of your like channel. So thank you so much, ma'am.
Thank you.
Thank
So I'm sure all the viewers are very happy and they know
you.
what to do when they lose the tooth. Thank you.
Yes, thank you.